Good day everyone, my name is Gerald Ababa Bisara from BSN 111F, a student nurse from Davao Doctors College of Davao. Today, I will be performing an oral medication administration return demonstration. So oral medication is a route of administration where a substance is taken through the mouth. So it is also the most frequently used route of medicine administration, as well as being the most convenient and least expensive. So the purpose of this is to provide a medication that has systematic effects or local effects on the gastrointestinal tract, or both depending on the drug action. So upon the procedure, it is really important to remember and adhere the 10 rights of medication administration to help us promote and ensure the client's safety and avoid making errors in administering the medications. So the rights of medication administrations include the medication, the dose, the time, the route, the client education, the documentation, reviews, assessment, and lastly, evaluation. So prior for the administration of oral medication, we first checked the doctor's order for us to know what medication should be given to the assigned patient, which ensures that the patient receives the correct medication. So let's first check the doctor's order. Next is to know the reasons why the client is receiving a medication, so it allows us to anticipate the effects of drugs and observe the patient's response. Then we check the medication administration record, or the MAR. So let's check the MAR. Okay. So that's why we check the MAR for the drug name, for the dosage, for the frequency, for the route administration, and expiration date for administering the medication if appropriate. So because orders for certain medications, examples narcotics, antibiotics, expired after a specific time frame, and they need to be reordered by primary care provider, primary care provider, and if the MAR isn't clear or pertinent information is missing, compare the MAR with the prescriber's most recent written orders. Next is, we verify the client's ability to take medication orally for us to determine whether the client can swallow, is NPO, is now seated or vomiting, has a gastric suction, or has diminished or absent bowel sounds. Next is we also needs to perform hand hygiene before the procedure to deter the spread of microorganisms. I am done washing my hands, or I am done the medical hand washing. So let's just disinfect our hands using the disinfectant alcohol. Now we can now arrange and organize the medicine tray, cups, medication for patient as per doctor's orders. Next is the BP apparatus if needed, and the preparation including medication tickets if not using in EMAR. We do this because organization of supply save time, reduces the chance of error. So in my case, my paraphernalias are fixed. The medicines or the medications are also well arranged, and let's proceed. Now take note that we must prepare the medication for one patient at a time, then obtain the correct drug by comparing the name of the medication on the label with MAR or medication ticket, and exit ADS after removing drugs. So this is to ensure that the right medication is given. So Next, then we check or calculate the drug dose as necessary, double check calculation, check the expiration date on all medications, and return outdated medication to the pharmacy. So in my case, I have already calculated my medicines, but I haven't checked the expiration date of it. So let's check the expiration date of all the medications that I have prepared. Okay. So if there are any expired, return the medications to the pharmacy. Now we should check the record for medication count and compare current count with supply available, especially if preparing a controlled substance. Next is double checking. Double checking reduces error because outdated medications are not safe to administer. So let's double check. So I am done double checking the medicines. So tablets and capsules. So if in the bottle, gently shakes the prescribed number into the bottle or into the bottle cup. So if in a box, shakes a prescribed medication into the medicine cup, since the medication is outside the bottle, so it is already unsterile, and therefore we cannot return the medicine back to the bottle. So we have to take a medicine cup and put the medicine on the place it in our medicine tray. So it just that case, like we don't open a medicine or a tablet on our working phase. So we open this kind of tablet and in front of our customer, so that we can inform our customer if what tablet he or she taking. So that's the procedure on how to do that. Next, for liquid medication or suspensions, thoroughly mix the medication. So mix the medication. Mix the medications like this. You don't mix the medication like this or like that. Mix it like this. This is the proper way to mix a liquid medication. So done. Next is to remove the cap and place it upside down on the countertop to prevent contamination. Okay, like that. Next is hold the bottle, so the label is next to your palm, and pour the label. So pour the medicine away from the label, because this is to prevent soiling the label and making it unreadable. So this is the label. So cover it with your palm like this, like that, so that to avoid soil the medication. Okay. Next is to place the medicine cup on a flat surface at an eye level. So put it on a flat surface like this. Next is place thumb on a prescribed level and reads it at the lower meniscus. Okay. So the meniscus is the curve in the surface of a molecular substance when it touches another material. This is done to have an accurate reading of measurements of the liquid medicine. Now, we should pour the exact amount of medication prescribed into the medicine cup. So, let's pour. Now, wipe rim of the bottle with a paper towel or tissue paper before capping. So I will just get a tissue paper. Next is to discard this. So since that our cup haven't or doesn't have any soil, so we can put it back. So just like that. That's how you do a liquid medication. Then next is to place this liquid medication into our medicine tray. Okay. Now for the drops, use a medicine dropper and dose up the amount of needed. So place or fill medicine dropper inside the medicine cup. So this is the medicine dropper. Okay. Now we're done. That's it. That's how you do that, or that's how we prepare the medications. Now, place the prepared medication on the MAR on the same port and check the room number against the MAR before entering the patient's room. 402. Room 402. Next is to provide patient's privacy. Hi, good morning. My name is Gerald Ababa Bisara from Davao Doctors College of Davao, your student nurse for today. So for your verification, can I see your wristband, please? Can you please state me your full name?
I'm Faith Kaimat.
Okay, so how about your birthday?
December 10, 2006.
Okay, that's great. So upon conducting the procedure, I will just secure the door if it's really close, and I will just adjust the room temperature and the lighting so that I can provide an adequate light. Okay, so wait for a minute. Okay, ma'am. So this time I'll be giving you your medications as ordered by your attending physician, Dr. Fernandez. Okay, so do you have any allergies in taking medications? Okay, then great. So if the medication to be given is highly acidic, such as aspirin, it can be given with a snack such as crackers. So if the food is not contraindicated. So now at the client's bedside, match up the MAR with the names of the medication as shown as earned on their label. If needed, perform the pre-administration assessment such as taking of vital signs. Okay, ma'am. Before I give you your medications, I will just get your vital signs, and the vital signs includes your temperature, your pulse rate, your respiratory rate, your blood pressure. Would that be okay? Okay, then great. So just wait for a second. I will just set aside my MAR chart. I will just get my paraphernalias. Are you alright? Are we good with that? Okay, then great. So wait for a minute. Okay. So I will just first get your temperature. Okay, so your temperature is 36 Celsius, which indicates that it is normal. Okay, then I will just get your blood pressure. Okay, your blood pressure is also normal. Just set aside this. Okay, now I'll be getting your pulse rate. Okay, your pulse rate is normal also. Next, can you please put your hand on your chest? I will be checking your respiratory rate. Okay, breathe. Okay, so you have a also normal respiratory rate. But before that, I will just set aside all the materials that I have used, and don't forget to disinfect the paraphernals that we are using. Okay, ma'am. So, Dr. Fernandez has prescribed you with Novolaxine. So, its generic name is Cephalexin. Its generic name is Cephalexin with a dosage of 500 milligrams to be taken every 8 hours, and it is in a syrup form, which means that you'll have to take it orally. So okay, so cephalexin is an antibiotic that is bactericidal, which means that it will kill the bacteria that causes your infections, which is the reason why you feel sick. Okay, so now we should assist the client in a sitting or side-lying position. So what do you prefer, ma'am? Sitting or side-lying position? Okay, so okay, sit down. Okay, that would be great. Okay. Okay, ma'am. So you are sitting now. So you are sitting on that kind of position. So are you sure that you can swallow or you can take your medication in that kind of position?
Yes.
Now, great. Okay, now. Okay, now. So administer medication and give the client sufficient water or prepare juice to swallow medicine. So I will just ask my patient, ma'am, what do you prefer, juice or water?
Water.
Okay, great. So I will just put some water. Okay. So stay with the client until all medications have been swallowed, because some clients will just hide the medicines or vomit the medicine, because in this case my medicine is a liquid form, so there are some possibilities that the client will spit the liquid medication. So be there, be in front of the patient and watch her swallow or take the medicine. Okay, ma'am? Here's your medicine. And here's your water. Okay, thank you. Okay, so you can return to your position. Are you okay?
Yes.
Okay, then great. Okay, so very good, ma'am. Now that you're done taking your medications, I'm gonna leave you here. I'm gonna leave you here so that you can have some rest. Okay, so do you have anything else? Okay, so I will just return to your room to check up on you. Would that be great? Would that be okay? Okay, that's cool. So thank you so much for your cooperation, Ma'am Faith. Thank you. Now that I am done with the administration of the medication to my patient, I'm going to proceed to the documentation process of the procedure, which I have just done. So the documentation would include the type of medication route and time it was given. So I have given my patient one type of drug as per doctor's order. So the drug is an antimicrobial drug with a brand name of Novolaxine and a generic name of Cephalexin, with a dosage of 500 milligrams, and for the frequency it would be given every 8 hours per RM. Now also included in the documentation for any complaints from the patient, and if the medication has been refused or omitted Then also document the reasons, and lastly, never forget to affix your signature on the documentation sheet, with which signifies that you have carried out the doctor's order. So I will just affix my signature. Okay. Next is to replenish the stocks and return it to its appropriate place, and perform aftercare of the equipment used by washing or cleaning them, and return them into its proper place. So after that, perform hand hygiene again, after the procedure, to ensure safety, and also to avoid the spreads of microorganisms. Oh, and that's it. That's the end of my return demonstration on oral administration medication. Thank you, and God bless.